There are a number of long-acting injectable medications indicated for the treatment of schizophrenia. Among them is once-monthly Invega Sustenna, paliperidone palmitate. In clinical trials, paliperidone palmitate was found to improve the symptoms of schizophrenia, including positive and negative symptoms. Efficacy was evaluated using the Positive and Negative Syndrome Scale, PANSS, and the Clinical Global Impression Severity, CGIS scale. Paliperidone palmitate also demonstrated a significantly longer time to relapse in patients compared to placebo. The initiation regimen for Invega Sustenna, 150 mg in the deltoid muscle on day 1 and 100 mg in the deltoid muscle on day 8, was designed to rapidly attain steady-state paliperidone concentrations when initiating therapy. Invega Sustenna has a demonstrated tolerability and safety profile with an excellent metabolic profile. In 2 13-week clinical trials, there were no observed differences versus placebo in the incidence of discontinuation due to changes in hematology, urinalysis, or serum chemistry, including mean changes from baseline in fasting glucose, insulin, C-peptide, triglyceride, HDL, LDL, and total cholesterol measurements. There have been few reports, less than 3%, of hyperglycemia or diabetes. There is also low weight gain associated with Invega Sustenna. The mean weight change for 12% of Invega Sustenna treated subjects was plus 0.7 kilograms during the 33-week open-label period of the long-term trial, while in the double-blind phase, mean weight change was plus 0.5 kilograms versus minus 1.0 kilograms for placebo. Paliperidone palmitate prolonged-release injectable suspension comes in pre-filled syringes as a sterile aqueous prolonged-release suspension for intramuscular injection, available in multiple dose formats. No oral supplementation is required. No reconstitution or refrigeration is required. For patients who have never taken oral paliperidone or oral injectable risperidone, establish tolerability with oral paliperidone or oral risperidone prior to initiating treatment. For the initiation regimen, it is recommended to start with a dose of 150 mg on treatment day 1 and 100 mg on day 8, 1 week later, both administered in the deltoid muscle in order to attain therapeutic concentrations rapidly. It is recommended that the second dose of the initiation regimen of Invega Sustenna be given 1 week after the first dose. However, to avoid a missed dose, patients may be given the second dose up to 4 days before or after the 1 week time point, i.e., the second initiation dose can be administered between day 4 and day 12. A monthly maintenance dose will be determined based on individual patients' tolerability and/or efficacy. The third and subsequent injections after the initiation regimen are recommended to be given monthly. However, to avoid a missed monthly dose, patients may be given the injection up to 7 days before or after the monthly time point. It is recommended that the initiation regimen be administered in the deltoid muscle in order to attain therapeutic concentrations rapidly. Following the initiation regimen, monthly maintenance doses can be administered in either the deltoid or gluteal muscle. Adjustment of the maintenance dose may be made monthly. When making dose adjustments, the prolonged release characteristics should be considered. For detailed guidance on managing missed doses, please refer to the Invega Sustenna product monograph.